So good morning, colleagues, and welcome to the presentation of the baseline findings of the CoCare Maternal Support Study. We are very pleased to have you with us today. My name is Dutum Kize from the Grow Great campaign. I'll be facilitating today's discussion. Unfortunately, Dr. Klaleng could not join us today. Grow Great, in collaboration with Stellenbosch University, Institute for Life Course Health, Research and Embrace Movement for Mothers, partnered with the Violence Prevention through Urban Upgrading, also known as VPUU, to undertake a study that aimed to provide localized evidence of what pregnancy income support can do for vulnerable pregnant women, and use this evidence to amplify the call for great social protection for poor women across South Africa. Today, we'll be hearing from the partners of this remarkable initiative about both what it took to get this project off the ground, as well as what the baseline findings tell us about the level of hunger for our mental health vulnerable pregnant women are currently grappling with in our country. So to kick off, we'll start with Kopano, our Executive Director at the Grow Great campaign, who will give the opening remarks on the bit of background and why, as Grow Great, we are so invested in the pregnancy income support and what we hope to achieve, and what we hope this income support will achieve in changing women's lives. Kopano will be followed by a short video on the CoCare initiative, and then we will hear from the CEO of VPUU, Michael Cross, the man behind this intervention itself, without which none of this would be possible. We will then hand over to Christina Lorenzi, the postdoctoral researcher at the Stellenbosch University, who will take us through the major baseline findings of the CoCare Maternal Support Study. After Christina, we will then hear from Memory Lindsay and Sadiega Abrahams. These are the community mobilizers who did the hard work on the ground, ensuring that pregnant women from different backgrounds benefited from the intervention. We can then open to you, to all our audience members, to send our questions and comments. Please use the Q&A button on the Zoom link to send all your questions, and at the end of the program, we'll go to those questions and get our speakers to respond. And then Koketso Moeti from Amanda.Mobi, who's the CEO there, will then give us the closing remarks. So please note that this webinar is recorded, and the recording will be available, and the CoCare Maternal Support Study baseline report will also be available on the Grow Great website. So for the past 3 years, Grow Great has been campaigning for improved social assistance for pregnant women. Tell us why is the need so urgent for mothers to be supported financially during pregnancy? Over to you, Kopan.
Thank you, Dudu, and thank you to all of you for being here with us today. As many of you will be aware, pregnancy is a time of increased health and social protection needs for both mom and baby. Optimal physical and brain development of the fetus depends in part on sustained access to both the macro and micronutrients necessary to support the healthy growth and development of the unborn child. Unfortunately, women in South Africa struggle to meet these very basic nutritional requirements necessary to ensure a healthy pregnancy. 1/3 of pregnant women live in households that run out of money for food, and 60% of mothers of young children live below the upper bound poverty line. In addition, pregnant women are especially vulnerable to unemployment at a time when they are facing increased financial pressures from pregnancy-related healthcare, nutrition, and transport costs. These challenges have significant effects on maternal and child health. 15% of our babies are born with low birth weight, and 1 in 4 children under 5 suffer from stunting. Low birth weight increases children's risk of stunted growth and development, and stunting has long-term detrimental consequences for children's health, education, and economic prospects across the life course. And of course, the COVID-19 pandemic has exacerbated an already dire situation for pregnant women in South Africa. Women were particularly hard hit by the pandemic and its economic effects. women made up the majority of the people who lost their jobs in the early lockdown in April, May 2020. And women working in the informal sector, which is where many women work, had no real safety net to buffer against this loss. Research has identified the positive impact that pregnancy income support can have on maternal and child health outcomes. The international literature points to the link between pregnancy income support and increased antenatal attendance, improvements in birth weight, reductions in neonatal, infant and child mortality, and declines in malnutrition. In our context, although the child support grant provides essential income protection for mothers of young children up until their child is 18 years of age, this benefit is only available once the infant is born, meaning that we miss a critical window of opportunity in pregnancy when much of brain development is happening. In addition, the barriers to uptake of this grant mean that only 65% of poor children benefit from this cash transfer in the first year of life. Extending the child support grant into pregnancy could be transformative. However, this approach has not been widely tested in our context, and this is what this ongoing research that we are involved in hopes to contribute to demonstrating. Our partners in this, Michael Kraus from VPUU, will speak a little bit more about the intervention itself, and Dr. Christina Lorenzi from Stellenbosch University about the research. But what is clear from the baseline findings is the urgent and critical need for improved nutrition support strategies for poor and vulnerable pregnant women in South Africa, whose needs have become increasingly more apparent during the pandemic. Considering that intrauterine growth restriction, or a baby growing too small in the womb, has been found to be associated with much of the global burden of stunting, providing women with pregnancy income support is likely to also contribute to reducing our high burden of stunting in South Africa, which researchers estimate is costing us 62 billion rand per annum. So improving women's access to nutritious food at a time when they need it the most is not only an investment in these women's health and well-being, but an investment in our country's economic growth and development. South Africa's National Development Plan identifies social protection for pregnant women and new mothers as critical to addressing poverty, inequality, and unemployment. The devastating impact that COVID-19 has had on the livelihoods of so many South Africans has made it more urgent than ever for this policy to move from aspiration to action. Thank you, Dudu.
Thank you so much, Kopana. As you rightly say, even before the COVID-19 pandemic, for the poorest 40% of the population, there was no nutritional reserve, and the nutritional status of many families was very fragile. The child support grant has indeed helped to keep severe malnutrition at bay. But COVID-19 now threatens to reverse the gains made since its introduction. Initiatives such as CoCare are critical to help mitigate against these losses. Here is a video on what CoCare is and what it sought to achieve.
As a social movement supporting mothers, we were being inundated by very real, desperate requests.
The issues that pregnant women are facing in South Africa now are not new. COVID has simply exacerbated a very dire situation.
There's a lack of kindness in the way we think about especially poor working class pregnant women. And then there's also a gap in our understanding of children's development as beginning way before the child is even here. In October of 2020, Germany donated 100 million rand in COVID-19 relief funding to the city of Cape Town to address food security issues in poor communities. violence prevention through urban upgrading, a well-established NGO partner would implement and allocate the funding.
For us, it was very important that it does not just become a relief project. We said it up front, and people came and just offered us relief, and we rejected that. We said it needs to look towards a rebuilding of a community, rather just then dropping some relief. The dropping of the relief is the food parcel story.
The relief project was multi-pronged, but one of the critical components were rapidly deployable digital food vouchers for selected vulnerable groups in Cape Town. These could be redeemed in spaza shops and house shops to inject cash directly into the local economy.
In the conversation with the local community and with Grow, Great and Embrace, where we looked at pregnant women, we realized it's a forgotten group in the pandemic.
VPUU doesn't specifically work with pregnant women, so Embrace and Grow Great, with their national network of mothers and infrastructure already in place, were brought in as partners to assist with implementation.
Unfortunately, for many women in South Africa, accessing just the basic nutritional requirements to ensure a healthy pregnancy is a great challenge. A third of pregnant women live in households that run out of money for food, and as many as 60% of mothers of young children live below the upper bound poverty line. And 1 in 4 children under 5 suffer from stunting. And stunting has long-term consequences for children's health, education, and economic prospects.
Currently, there is a child support grant, but pregnant women are excluded even though a child's growth and brain development in the womb relies mostly on adequate nutrition. If we are to give children the right start in life, we should be lobbying to extend the child support grant into pregnancy. Could the pandemic, for all of its destruction, be offering up an opportunity to test run the idea of a grant for pregnant women?
One of the things that we loved about a digital voucher is that it gives women agency to make decisions based on what they need for their families.
And it's also a way of looking at how you can encourage people to use the grant money within their own communities. That circular economy starts to really become robust. Registration, verification, and delivery of the vouchers to pregnant women was going to be a mammoth task. It made sense to reach pregnant women through clinics. Normally getting access takes time, but because the situation was urgent, the Department of Health and the City of Cape Town got behind the project, giving Embrace and Grow Great the access they needed quickly. VPUU, Embrace and Grow Great leveraged their networks and set up 14 clinics and 7 community halls for registration. An all-women team of field workers who could relate to the pregnant women were recruited from the communities, and Embrace briefly put them through some training. Registration soon began in earnest.
Shoo, I just thought what a massive, daunting task. But I think Julie did a great job in saying, like, look, we are going to be flying this ship as we build it.
So what we learned as an organization is that we can mobilize on a very, very short period of time, and we can galvanize ourselves behind an idea.
For all of the people who needed to come to the party to give access and authorization, the provincial government, the district administrators, the hospitals, it would have taken at least 6 months. Everyone was registered within 6 weeks and they started receiving their vouchers.
We were really able to pull together as a team, sitting at different levels, not being able to meet face to face, making it happen.
It was money being thrown directly at the problem, where in some of these environments where I find myself working, there's just too much. Everything is just needs to be perfect on paper first and needs a policy before being implemented.
How do you break down complexity? It's really to have a starting point and then to connect the dots. Part of connecting the dots is connecting with other organizations in the space, with networks that have got a broader coverage. If we then join forces, I think our outcomes will be so much better.
The government need to call a meeting for people to come to the meeting so that they can access them, whereas we can just walk down the street and go to the people, to your neighbor, and go speak to your neighbor. They were surprised, they were excited, and they were telling their neighbors if they knew of someone that was pregnant. Everyone was informed. Everyone was informed, and that was a good thing because now they are being taken care of.
In the end, 2,777 pregnant women received 6 sets of 300 Rand vouchers over 4 months.
We only had so much funding, we only had so much capacity, and we only had so much time that we need a sustainable solution. A project like this will only ever be a stopgap.
The government needs to give serious consideration to a maternal support grant. The literature shows clear links between pregnancy income support and improved maternal and child health outcomes. Considering that for the most part stunting is preventable, it's short-sighted to shortchange the next generation of South Africans in this manner.
Let's come together as civil society, as government, as policymakers, as decision makers, as thought leaders to take what we've learned and use it to build systems that will continue to support pregnant women for years and years and years to come.
Please let us welcome the CEO of VPUU, Mr. Michael Cross, who is responsible for making available close to 100 million in COVID-19 relief funding to disadvantaged communities in the Western Cape. Michael, tell us a little bit about VPUU and the work you do, as well as why you thought it is critical to include pregnant women as a critical stakeholder group in the CoCare initiative.
Thank you very much, Dudu, and welcome everybody. It's an honor to be part of that. The video is just wow. I'm so impressed to see everything coming together. I'm very pleased that we have the opportunity and we finally arrived. From my side, I just want to give a couple of points. As Kopana has said, for us, COVID-19 has been an amplifier of disparities in our country and society. And it has really laid to bear the privileges and the exclusions in our society. While the pandemic has mobilized a lot of energy within the civil society, private sector and the public sector, many of those initiatives got stuck in relief and the notion of handing out food parcels and meeting urgent needs. This has an unintended consequence of a paternalistic approach of further entrenching dependency rather than working in a partnership approach to build on community coping strategies and use the opportunity of the crisis to realign the discourse of how we want to live together towards a safe, sustainable, and more equal society. While food insecurity is a key feature of the pandemic for poor people, it is one amongst many needs. Based on the 15 years implementation record of violence prevention through upgrading, by following the approach of listening to the citizens in low-income areas of the so-called Cape Flats, co-producing a vision to a safe and sustainable neighborhood, and working with the citizens as partners, it was our duty to mobilize around a vision of building community circular economies on neighborhood scale. How can we all contribute to bring about hope and pride to the people with the biggest needs? Since such a comprehensive vision towards safe and sustainable communities can only be achieved with committed partners, we reached out to many organizations and networks. We found funding partners in the form of the German Development Corporation, by the German Development Bank, and the city of Cape Town that were willing to contribute close to 100 million towards 8 neighborhoods in which we have been active and had built the relationships to start tackling the disparities well beyond COVID-19. Our role as intermediary between the citizens' representative organizations and the public sector made us the trusted partners to test the ideas of listening to communities and agree what can we do together by identifying the interventions and the target groups, getting the right data to analyze, to verify the assumptions, and to be able to track whether we can make a difference. When assessing scalable solutions to make an impact, we partnered with the community CoCare voucher, a simple solution initially tested by the DJ Merit Trust. the South African Council of Churches, and many other civil society organizations, as well as FLESH. In being true to realigning the discourse about what society we want to live in, we are testing the notion of the basic income grant, whereby we send every 2 weeks 300 Rand to the telephones of specifically selected groups of people in need. Those people can redeem the digital vouchers for products available in local spaza shops. While we recommend the 10 best buys of nutritional food, the voucher can also be used to purchase airtime, electricity, and other items required to keep the household afloat. We opted to local spaza shops to ensure we're strengthening the local economy, rather than replacing it by provision of food parcels or large corporates. It is our intention to be inclusive to our foreign neighbors who often run the spaza shops, and work together with our foreign brothers and sisters to resolve the situation. Following life cycle approach to enable the individual's development to full potential, we partner with the leading organizations in the field of caring for pregnant women and nutritional needs for children, Grow Great and Embrace. While working in partnership, we are learning much clearer how to look after the well-being of pregnant women and what pathways to eradicate stunting are there. When we found each other, we committed to use this short-term funding to mobilize and advocate for a larger idea of a maternal grant that meets the needs of pregnant women and unborn children to contribute towards a more equal society. We specifically included pregnant women because we know that the first 1,000 days of a child's life, in order from conception to the age of 2, is a critical period of health, growth, and neurodevelopment that forms the foundation for the rest of the child's life. Children's healthy development relies on adequate, healthy nutrition, which in return requires a food-secure household. We as the speakers today are highlighting many pregnant women in South Africa live with great vulnerability. And this is why it was imperative that we include pregnant women specifically. Support is provided in the form of a 300 Rand fortnightly digital voucher over an initial period of 16 weeks between November and March 2021 to a total value of 2,400 Rand per recipients. At the value of, currently we have spent more than 6 million Rand. We are extremely proud to be part of the initiative to test at scale what differences a maternal grant can have on the well-being of pregnant women and their babies. We are currently negotiating an extension of the initiative until September this year. The early learning sector has been hit hard by COVID, which has a detrimental effect on children's education and their income situation for ECD teachers and caregivers of children, which are almost exclusively women. To ensure some form of early learning and to prevent a widening of the gender gap, we contributed digital vouchers to about 15,000 parents of children below 7 and ECD caregivers in about 250 ECDs in the 8 neighborhoods of Hanover Park, Menenberg, Bonteheuwel, Nyanga, Guguletu, Kuyasa, Harare, and Monwabisi Park. The last 3 are in Khayelitsha, with a total population of about 500,000 people. We provide to ECDs in need repairs and basic services, such as a sanitation system for ECDs in informal settlements, fences, ceilings to increase the comfort level, some PPE and compliance packs, COVID compliance packs, play equipment, and a capacity building by supporting networks around ECDs. Local food production is nurtured by supporting 74 food gardens. The support includes soil enhancement and production, nurseries, seedlings, boreholes, water tanks, fencing, tools and digital vouchers to gardeners. Parallel to that, we provide training to the farmers and support to support the emergence of local networks of food producers to start keeping circulating locally produced food in neighborhoods. This is a long way to go, but we start taking first steps towards a local food production of food, linking this to feeding schemes and ECDs and ensuring organic waste goes back into the soil of the gardens to nurture the next crop. Currently, we support 202 food kitchens with vouchers to reward the volunteer cooks and provide ingredients to support about 200,000 meals a week. COVID has laid bare the digital divide in our society. While people in affluent neighborhoods are able to switch from face-to-face to digital meetings and work, our event today is a testimony of that. People in low-income communities rely on prepaid vouchers for data that cost up to 100 times more than the data we pay. In April and May last year, we opened up our internal networks from our active boxes, our neighborhood centers and informal settlements, and put up Wi-Fi hotspots in one informal settlements, enabling ECD learning, business support, surfing of the internet to about 5,000 people. Today, we have 60,000 users and are busy connecting more than 80 ECDs via a mesh network, allowing access to educational materials via a local server free of charge, and providing 175 megabyte daily or 5 gigabyte per month of data on internet per user via the local Wi-Fi network. By the end of May, this network will be operational in 3 out of the 8 neighborhoods I mentioned. We want to reach 100,000 users in the first 6 months and be part of the digital learning for our young children, as well as young learners, matriculants, and students for their further studies. I hope I was able to describe that we are accountable and aim to work inclusive as partners to incubate innovation and seeking to scale solutions that contribute towards a safe and sustainable neighborhoods, to lift the discourse of a more equal society. Our partnership with Grow Great and Embrace and DJ Merit Trust allow us as partners to amplify our individual efforts and align towards the common goal. Thank you very much.
Thank you, Michael. This intervention was desperately needed, as many women in South Africa are struggling to meet the basic nutritional requirements to ensure a healthy pregnancy. As Dr. Kopano mentioned, we know from the international literature that pregnancy income support for poor, vulnerable women can help shift the needle on maternal and infant malnutrition. But we do not have sufficient body of local evidence to demonstrate this in our own context. Well, until now, Dr. Christina Lorenzi will be sharing the baseline findings of the CoCare Maternal Support Study, which aims to provide localized evidence of what pregnant income support can do for vulnerable pregnant women. Over to you, Christina.
Thanks so much, Dudu. So I'm going to be sharing today some of the findings from the CoCare Maternal Support Study. We were really lucky to be building off of this amazing effort, which you've heard about today from VPUU, Grow Great, and Embrace. And our aim in kind of latching onto this ongoing implementation effort was to really try and build an understanding, albeit through a very rapid assessment of what the impact was and the potential impact was of this CoCare voucher scheme. As Kopano has also talked about, we know that the COVID-19 pandemic has exacerbated a really dire situation for many tens of thousands of pregnant women and mothers in South Africa. And we're hoping that we'll be able to use some of the data that we've collected from this study to build evidence for the South African setting and also build momentum to bring this maternal support grant to reality. So the methodology that we used, again, like everything with the study, it was put together very quickly, but we really wanted to try and reach as many of the pregnant women who were going to be part of this CoCare scheme as possible. So we conducted a baseline survey ahead of the voucher rollout. This was around October of 2020. And we had 2 forms of surveys. So we had an SMS survey, which was conducted through a USSD string message that women would receive to be able to join. And that was conducted and completed with 2,618 women. We also had telephonic surveys that we conducted with a subset of these women. So around 590 women were called and followed up following their completion of the SMS survey. All pregnant women 18 years and older were able to join if they were living in the select areas about which we've already heard. And they were recruited at the same time that they were recruited into the CoCare voucher scheme. So from November through round about now, there's been the rollout of this voucher scheme. Follow-up survey is currently underway, so we're going to be following up the women who've received these vouchers and asking them the same questions. And we have ethical approval from Stellenbosch University's Health Research Ethics Committee. I just wanted to also give a nod to the other partners from whom we've already heard. And I'm part of the Institute for Life Course Health Research, which is based at Stellenbosch University's Department of Global Health. So I'm going to walk through some of the SMS survey results here from the 2,618 respondents. You can see with the area of residence, we had quite a broad group that we were targeting. All of the women were originally coming from the 8 target areas, but then it expanded to reach a few others living in other places. So Kailicha was the most represented area, followed by Nyanga, Guguletu, Bonteheuvel, and Manenberg, with other areas being represented in smaller portions. In terms of the demographics of the pregnant women who completed our SMS survey, the mean age was 29.1 years. Most of our participants were between the ages of 25 and 34, and around 40% were having their first child. We also asked about income and employment, and I think these are really important numbers to put in context with some of the other employment data that we've recently received from national statistics, because it really shows the vulnerability that is potentially unique to these pregnant women from these communities. So we asked about past month employment, or if they had any kind of job selling things, earning any kind of income, and 29% of the SMS respondents said that yes, they had. So this means that around 71% had no past month employment. When we asked about upcoming prospects for employment, this number was even greater. 82.5% of our SMS respondents said that they did not have any paid activity or job that they'd be returning to in the coming 4 weeks. And while this may have something to do with the fact that some of them were further along in their pregnancies and maybe were expecting to give birth soon, in many cases, as Kapana mentioned before, we have many people working in the informal sector, and also potentially people losing jobs linked to their pregnancy status. We also asked about grant income. So we had 75% of participants or respondents who had some kind of grant income coming to their household. This wasn't always direct. So in some cases, this was a pension grant and somebody else maybe was receiving a disability grant. In some cases, the pregnant women themselves were also receiving grants. But this means that 25% of the sample were in households not receiving any grants. And when we look at these women living in non-grant households, we can see that just over a third of them have been employed in the past month. So this is very comparable to the kind of numbers from the larger sample. And 60% of these women were first-time mothers, so they weren't eligible to be receiving child support grants for any other children. We also asked about maternal hunger, and we used the same questions that were used, for example, with the NIDS CRAM survey, so that we could have some comparability between studies. So we asked mothers if or pregnant women if they'd gone to bed hungry in the past week, and 39% responded that they had. This is a really high number and higher than what we've seen from other data. When we asked how many nights they went to bed hungry, around 27% said that it was more than 1 night per week. So this is a really high number of women reporting hunger in the past week. We also asked about child hunger, and we asked the same question. So how many of you had a child in the household who's gone to bed hungry in the past 7 nights? This wasn't necessarily a child belonging to, of that mother, but it's a child in the household, any child. And the rate for this, out of the 2,400 roughly respondents who had children in their households, 24% responded that the child had gone to bed hungry in the past week. Again, we're really seeing high numbers. Most respondents reported that this was 2 nights, 1 night, or 3 nights. And it also brings up an interesting question about maternal shielding, which is something that we've spoken about and think about with regard to how mothers protect their children or protect children in the household from the impact of household hunger by trying to reduce their own portions to be able to feed their children. And while that's very well may be happening in many of these households, we're also seeing that there's still a very high percentage of children who are reported to go to bed hungry. I just thought I'd take a quick moment to compare this to current findings from the NIDS CRAM Wave 3 survey, which was conducted around a similar time towards the end of last year. So we could kind of put this in context. The NIDS CRAM looks at a more representative population of South Africans, whereas CoCare focused specifically on pregnant women in a smaller area. But we're seeing much higher rates of reported past week hunger for our pregnant women respondents, as well as the children living in their households when you compare to the 18% and 16% that NIDS reported in their Wave 3 data. And again, I think it's important to remember that these numbers are still higher than what we're used to seeing in pre-COVID times. We also asked a few questions about mental health to understand what women were experiencing with regard to their mental health and well-being. We had 2 questions that were derived from the Patient Health Questionnaire, which is used to screen for depressive symptoms, and they were conducted over a 1-week recall period, so we asked in the last 7 days. The 2 questions involved asking about feeling down, depressed, or hopeless, and asking about little interest or pleasure in doing things. And in this case, quite similar rates of response, seeing between the 2 questions, seeing around 61 to 62% of women reporting, at least for a few days, feeling either of these or both of these. Again, these are relatively high numbers. When we look at both questions together, we can see that there's some version of yes, 45% responded, some version of yes to both questions. I also wanted to just do a little bit of a quicker look at the Telephonic survey results. Some of the questions were quite similar, but they also took a little bit of a deeper dive into some of the questions from the SMS survey. In some ways, we had a team of research assistants on the phone, and so they were able to probe a little bit more, and so we were just able to add a few more questions to this. But again, this is a subset of the original group who responded to the SMS survey. We asked a few questions about dietary diversity, and this was about 16 food groups that we asked about in the past 24 hours, if women had those foods in the past 24 hours. So we used the Women's Dietary Diversity Score calculation, which compresses these 16 food groups into a core 9 food group core. And the average score between the range of 0 to 9 was 4.9. We're also seeing that many women had either medium or high levels of dietary diversity. So medium is closer to like a range of 4 and 5 food groups, and high is 6, 7, 8, or 9 food groups. So starchy staples was the most common category. So the vast majority of respondents reported consuming some kind of cereals, breads, potatoes, but there were also other representation across vitamin A rich vegetables and fruits, meat and fish, etc. This finding was relatively surprising to us because given the high rates of hunger, we hadn't expected to see such high rates of dietary diversity. However, it's important to remember that this tool doesn't mention or ask about quantity or frequency of getting these nutrients. And I think that's something that might temper some of these findings a little bit more. We also asked the full range of questions from the Patient Health Questionnaire 9. So this is a 9-item scale from which those 2 original questions were taken from. And this is used to kind of assess risk of major depression. So we looked at items such as trouble concentrating, feeling tired, appetite, sleep, thoughts of self-harm, and feeling better off dead. And this is in the past 2 weeks. So if we look at the distribution of scores, which can go all the way up to 27 as the most severe cases, we see that 30% of our sample were scoring at or above the cutoff of 10, which is used as a predictor of diagnosis of clinical depression. This is not a diagnostic tool, but it's often used as a way to screen for depressive symptoms. So this number, again, it's relatively high. I think it's not, we've had some studies that, for example, the institute that I work with has done in Kailicha, and we've seen similar rates of mental health issues within pregnant women in samples of mothers, but it's much higher than the general population than what would be expected. I wanted to take a little bit of time to also just explore some associations, just to give us a sense of how some of these areas might be linked. Again, this data is still baseline data and it's still very much preliminary. So we're looking at conducting additional analyses, and Mercedes from the Grow Great team has been really instrumental in looking at this data. So I just thought I would give a brief overview of some of the odds ratios and data that we've looked at. so far. So looking at maternal hunger and mental health, we see, not unexpectedly, that women who are reporting past week hunger were 3 times likelier to report feeling down, depressed, or hopeless, and nearly 2 times likelier to report feeling little interest or pleasure in doing things compared to non-hungry women. And women were also reporting more severe levels of hunger, and they consequently had a higher likelihood of reporting poor mental health. They're also twice as likely to respond yes to both mental health questions if they had reported past week hunger. With regard to the telephonic survey, we see that past week hunger also correlates with higher symptomatology on the PHQ-9. So again, these aren't necessarily surprising findings or things that we might expect to see, but I think it also points to the importance of thinking about mental health and hunger as linked. So we have, potentially pregnant women who are struggling with their mental health, who may struggle to access food. And similarly, having limited food and resources in the household may lead to poor mental health at a really, really critical time for both mental health and well-being and nutritional support. In terms of child hunger and maternal mental health, we saw even greater odds of poor mental health linked to reports of child hunger. So where women reported that a child was hungry in their household, they were 4 times likelier to report feeling down, depressed, or hopeless. And again, twice as likely to report little interest or pleasure in doing things. The odds of feeling down, depressed, or hopeless increased by a large margin, 53%, as nights of child hunger increased. And while women reporting their own hunger were twice as likely to report yes to both mental health questions, in this case, reporting child hunger, they were 3 times as likely to report yes. So it was a much greater risk of reporting poor mental health linked to child hunger. The last 2 numbers I'm just going to share is that pregnant women who had past month unemployment were also 29% likelier to report past week hunger, and 51% likelier to report past week child hunger than those who had employment opportunities in the month prior. And grant income was also correlated in the telephonic survey with higher symptomatology on the PHQ-9. So those women, that 25% of women or so who were receiving no grant income were much more likely, 63% more likely to report higher, worse mental health symptoms. So just to wrap up, there's a few conclusions that I think we can draw from this data. This is obviously just the baseline data, so we don't have any understanding yet of what the potential impact of CoCare vouchers may be for this woman's mental health. But we can see from this data that it's exceptionally high levels of hunger, household hunger, and poor mental health in this sample, coupled with limited employment prospects at a really vulnerable time for any women, but especially the women that are living in these high adversity contexts. And we know that this right to a pregnancy, which is supported by adequate nutrition and mental health and well-being, is really out of reach for many pregnant women, especially given the challenging economic, social, and health circumstances that our country and the rest of the world is going through. And I think it's important to think about the role of pregnancy and the importance of this pregnancy period. As we've heard from our other speakers, having this window of time to intervene is really crucial, and it's the best and most important way to kind of avoid this entrenchment of intergenerational risk. So really thinking about sustainable and adequate ways to support pregnant women, such as a maternal support grant, is essential. And it's especially essential in this precarious economic time and the settings that these women are living in. So luckily, the vast majority of the women who were interviewed or surveyed as part of this study are receiving CoCare grants, and that's wonderful news. But I think we also need to think about how we can extend these benefits further for many other women living in South Africa and in the future to take this forward and to provide maternal and child support for the next generation. Thank you.
Dudu, I think you're on mute.
Thank you, Christina. Hopefully this local evidence will get us closer to obtaining financial support that our most vulnerable pregnant women need in the form of the maternal support grant. We are seeing lots of encouraging comments. Thank you. Also remember, if you've got any questions, you can send them via our Q&A button. So the ladies, the people that have been on the ground, our community mobilizers, these are the people that without them, this study would not have been possible. They help to recruit pregnant women from their communities through local health facilities. Memory Lindsay and Sadega Abrahams spoke directly to the moms who received the CoCare voucher. They also live in the communities they serviced. Who is better positioned to paint a clear picture of the desperate need for the financial support by the most vulnerable in our communities than Memory and Sadega? Memory and Sadega, thank you for being with us today. I will start with you, Memory. Please tell us about the role you played in helping to register the pregnant women for the CoCare food vouchers.
Thank you so much, Dudu, and everyone else, and other people watching. Actually, I live in Nyanga, and I was privileged enough to register women from 3 different hospitals. I was registering women at Guguleto MOU, Nyanga Clinic, and also Masnedani Clinic. Now, normally at Guguleto MOU, it's a bigger MOU, so it would have many pregnant women on a daily basis, not less than 50 pregnant women on a daily basis. Compared to Masnedani Clinic, which is a bit far off from the main road, it is kind of secluded, so there would have maybe 6 women per week. So you can see the comparison is that we're not having many pregnant women at Masnedani. But over the course, as the project was going, after like 1 month, we saw that there was an increase at the number of pregnant women coming to Masnedani Clinic because they heard that there was this initiative taking place at the hospital. Now, to me, that translated that there is a desperate need, because if such a hospital is able now to have more than 10 women per day coming to the clinic from a number that was like 7 per week to more than 10 to 20 women per day, that is an increase and an outcry from the community to say that there is a need for that help because the word was going out. And I would also like to add to say, even though this project has started during a COVID-19 pandemic era, it is a project that we should have recognized as a need even before. And this was just an opportunity for us, for this project to start. But as a people, we should recognize that this is a need in our communities, specifically recognizing such a community as where I'm coming from, that there is higher poverty levels and there's much unemployment. And also most mothers are single mothers and they need that support. So it is not like, I didn't feel like we were doing these pregnant women favors, but rather we were closing a gap that was there before. And I felt like I was honored and proud to be a part of this initiative, to be on the forefront of actually connecting these women to this resource. And also such initiatives, I feel like shouldn't be for just a small group of people or specific area. This is something that should go nationwide, which is why the maternity grant is very important. The maternity support grant should really grow and just be out there. Thank you.
Thank you so much, Memory. Sadega, what did it mean to you to be able to enroll women from your own community into this initiative?
Good morning, everyone. Thanks for having me here today. You know, when I initially found out about the project and that they were looking for a registration offer, I jumped at the opportunity. Basically because I know what the need is in the community, and I know how people struggle, and especially our pregnant women. And it was something that was really close to my heart, because at some stage, I am a mom, and at some stage I was a pregnant mom as well. So I was passionate about it because I too at one point was going through one of the emotions that these pregnant moms are going through. I knew what it was and how it felt to be going to bed hungry, or, you know, going to bed without that meal. And I worked in the Manenberg area at Manenberg Clinic, and I saw close to 20, 30 people per day. And, you know, every day there were just more and more people coming because the need was so high. Unemployment is rife. It was before COVID-19 hit us. And when COVID-19 did, it became worse. So the need were there. People were really struggling. And people were appreciative of the fact that there is someone out there willing to help them. So yes, I feel strongly that having something to eat is a basic human right. You know, it's the right of these women to be able to go to bed and say, I didn't go to bed hungry, you know, or I'm not having this type of emotion because I was without food. You know, I'm not feeling self-destructive because I was not able to feed myself. And, you know, as a mom, and I'm sure other moms can relate, that we often neglect ourselves so that we can see to other people. And this grant will actually ensure that we see to ourselves as well, that we know that there is support for us too, you know, because it's really a need. And I'm sorry, I'm getting a bit emotional here now, because I've seen firsthand the suffering of women. I've seen firsthand the suffering of pregnant moms. And sorry. I don't feel that, you know, our pregnant mothers should be in this situation, because after all, we're going to be giving birth to the leaders of the world, and being able to you know, have that nutrition to support that unborn child, and, you know, to actually be out there in the community even now and speaking to those mothers, and knowing that, you know, these mothers have these fears. I am pregnant. Am I going to be able to, you know, to feed my unborn child? Am I going to be able to get through these pregnancies? And this was actually a huge resource and something that I am passionate about, and support 100% that it should be a permanent thing, because the need is so great, you know, in a lot of our Cape Flat communities, if not all of them. So yes, thank you.
Thank you so much, Sadiqa. We are all very passionate about this matter, and we can see your passion for your community. Thank you so much for sharing. Just like some closing remarks from both of you, now that you have contributed successfully enrolling over 2,500 pregnant women into the Food Voucher Initiative, which is an amazing achievement that you guys have done. What are you currently working on, and what's next for you? You can start, Memory.
All right. I think we are all for mothers. So we are currently working on a Mamandla Fellowship Program, which is another initiative by Embrace. Both of us, actually. So, yeah. So it is another project that has got a big concern about motherhood issues here in South Africa. It tackles many areas about motherhood. And the greatness of this project is that it brings in a diverse group of women together, maximizing on the power that comes when you bring a diverse group of women, because there comes with it different resources, opportunities, and strengths. And when we come together, we create something bigger. So we are currently working on different ideas and projects concerning mothers here in South Africa and improving the lives of motherhood, as well as empowering women. Thank you.
Thank you. And Sadiqa?
Well, I've been utterly and truly honored to be chosen. I think both of us are, to be chosen as a Mamandla Fellow. You know, they are a group of ladies who are trying to uplift mothers and mothers-to-be in communities. And as a fellow, I would like to take that into the community, you know, and lead the efforts of the community. I currently do work in the community right now, and I would like to deepen the passion of support to all mothers and mothers-to-be. And, you know, at the end of the day, it's about ensuring that they have the resources, ensuring that they have someone there to even just listen, you know, because just listening to someone and giving them a hearing about what their problems are, what their struggles are, makes a big difference. So currently I'm working on an initiative where I'd like to create a safe space for pregnant mothers and young moms, and, you know, just a place where they could access maybe not all of the resources right now, but at least some of the important resources that you know, they may need immediately. So that is something that I'm working on, because I truly feel that when moms share, you know, the difficulty of the world or the difficulty of their struggles, when they have a place to share their dreams with other moms, you know, the realities of the world are not that heavy on them after all, because they realize that they're not alone, and, you know, that there's a whole scope of other moms too going through the same thing. And what better way to help another mom is when you have other moms that are truly supporting them. Thank you.
Thank you so much, Sadiga. We would like to hear from more people. So I'll just read some of the amazing comments that we have received on the chat before I proceed to go to the questions. On Facebook, Maggie Max says she's appreciating Memory and Sadiga and the hard work that they did in the community recruiting moms. Thank you so much, Maggie. And then on our chats here on Zoom, we've got some amazing comments, very encouraging comments. We had one from, just going through some of the questions, from Julian May saying CoCare child hunger prevalence is similar to the figure reported by the Ask Africa survey that was also undertaken during this period. And we've got Chantel saying population like South Africa that rely on purchased food have higher DD score than the subsistence farming. And she's proposing that nutrient quality is more important for dietary intake, e.g. along the 10 most nutrients-dense foods, like eggs, liver, and particular vegetables like yellow and orange vegetables. And thank you, Matthew. He says, this is really amazing work. Congratulations to all of you for doing something really special. This framework and its underpinnings takes this to another level above the previous similar projects. Thank you. And then we've got, who is here? Who says, in the Portfolio Committee on Social Development yesterday, the Department of Social Development reported that it was working with other departments to design policy on grants for women who are in antenatal phase. That is like amazing news. Karabo Mkwena says, this is really incredible work. Ladies, amazing work. Your passion for these issues will give you strength to continue saving lives. Thank you so much, Karabo. I think this comment is directed at Memory and Sadiga. Thank you. I'll just quickly go to the questions and address them directly to all the panelists, and I'll read all the questions. We've got just a few questions, and then I'll read all of them and then you can respond. Rolina Matebula says, no, I'll go to an anonymous question. It says, what does sustainability through this look like? Is it food gardens or is it the maternal support grants? And then Rolina Matebula says, what are the requirements in order to be part of this initiative? Chantel Witten asked, is it possible to connect our pregnant mothers to the small growers so that moms have access to nutrient-dense, fresh vegetables while the growers have secured paid supply lines? If we are pursuing nutrition outcomes, we need to provide nutrients, we need to provide nutrition inputs. I'll also just see some of the questions have already been answered by our panelists via the chat. So I'll just read those questions as well for the people that haven't seen them. So Venetia Oliphant says, well done, Grogret, with another awesome initiative to support our most vulnerable in the community. I would like to know what is the selection criteria was for the communities to which CoCare vouchers were rolled out. And then Roisin says, please, can you explain briefly how the SMS survey worked? Was this free for participants? How reliable is this as a data collection method? Did you find people started the survey, then stopped, so you had a number of incomplete questionnaires? I'll open to the panelists to start answering the question. Thank you.
Thanks, Dudu. I can just speak quickly to the question that I responded to about the SMS survey. So it was free to participate, and we did have some incomplete responses. We were able to track those individuals who had started the SMS survey but hadn't finished yet. And so we were able to link with those people, sometimes through calls, sometimes through push notifications like an SMS, just to remind them to try and answer the survey. So there was a little bit of push. It wasn't 100% without some kind of additional effort, but that was a relatively successful strategy in reaching those individuals. Thanks.
Thank you, Christina.
And I will also just answer one of the questions about what do you have to do to qualify. For the pregnant mothers, you had to be at a clinic. That's where we were registering the pregnant women. You had to be at a clinic, and we'll take down your details, for instance, your name, your number, your phone number. And if you didn't have your ID, you would have to come back and bring your ID, or else we'd gather women on a Saturday just to make sure that we collect whatever necessary information that we had. And after registering them, there was an application we were using. They would receive an USSD SMS and a survey to complete, where the registration was confirmed, and then later on they would start receiving the vouchers. The vouchers would come through an SMS as well on the phone, and it would continue after every fortnight. Thank you.
I think Michael Okopano, you can respond to these questions. We have had two questions that are similar from Rolina Matebula and from Veronica. They all want to know, how do they get their communities to be part of this similar initiative?
Yeah, I'll give that one to Michael. I mean, I know that this is a tremendous effort on his part with the City of Cape Town to bring these into these particular communities in the Western Cape. And I don't know, Michael, to what extent this will be taken beyond the Cape Metro. But, with these kind of initiatives, they give us an opportunity to provide necessary relief at a time of great devastation. But we also need to be looking into the long term. And I think the big long-term goal here, and what we're advocating for, and many others are advocating for, is to, extend the child support grant into pregnancy, or introduce a maternal support grant. So I think in terms of long-term sustainability, which is what somebody who wrote anonymously, what does this look like? I think it's really the big advocacy push, because, as we've spoken today, the evidence is there. The cost is not that huge if one considers 1.2 million approximately pregnant women per annum, but the long-term return on investment, it really is, we're missing a trick here in terms of what we can do for the next generation of South Africans. But I'll let Michael speak around CoCare itself and whether there's any prospects of that going into any other parts of the country.
Thanks, Kopano. Yes, I think those eight, or not, I think the 8 neighborhoods have a history with VPUU. So we mobilized the funding and there is a relationship that we had, as I mentioned, is up to 15 years. So it was relatively easy to mobilize for that because I think we shouldn't underestimate if you have a project like that going into a community that's not prepared for that, where you potentially end up with a project like that being politicized. So it was important to have those trusted partners in the community and have that relationship. As Kopano said, we are an intermediary between the city of Cape Town, the province, sometimes national government as well with those communities. So that allowed us and enabled us to fundraise that. And we're very fortunate that the German government provided some funding here. In the form of the 100 million. Can it be replicated? Yeah, funding is there. I'm sure it can be replicated. We're talking to many other communities in the country. For me, the question of sustainability, and I think we have to look a little bit more holistic at that. Yes, there are the small steps like linking a food garden with a soup kitchen or with an ECD, etc. What's already practiced. But if we are realistic, the food gardens in those communities or in communities in general will not resolve the nutritional problem. The produce is simply too little. It is important to supplement, but it won't resolve the issue. So I think we have to look about and come as partners rather than really disband our ideas of being paternalistic here. We really have to ask the community, how does success look like on your side? How does sustainability on your side look like? And what we were advised, look at the ECD sector to make sure that women get the economic independence by providing, in essence, a salary subsidy through the digital vouchers. We see a lot of, and I think maybe I can rephrase the question that was asked by the anonymous, what is the future of a voucher, digital voucher? Yes, it can be the maternal grant. Yes, it can be a basic income grant, but it can also be a mechanism of rewarding voluntary work. And that's what I would really like to see as well, that on the one hand side, yes, there's a defined target group like pregnant women, but can it go wider? And can we reward voluntarism in communities to strengthen those protective factors, which are so important in order to build that sustainability and narrowing the income gap and get more sustainable. Thank you.
Okay. I will just take one question from Matthew. He says, is there a thought about having another external control group so that you can draw more definitive conclusion about the project effectiveness? Can someone, Christina, answer that briefly? And then
yeah, I can speak to that. I don't have a very good answer, but I think because this research was devised very rapidly, kind of as the CoCare voucher scheme was already beginning to kind of be implemented, and it's also a budgetary consideration. We didn't have a very, very large research budget. We tried to really think about the most succinct and brief research questions that we could be asking. And again, this was done only with the sample who was going to be receiving vouchers. So we didn't actually have a control sample that we identified. I don't know that there was scope to do this for this current rollout, but I definitely think if these kind of preliminary data are showing potential impact, it would be really important to do this in the future and really try and advocate for a larger scale, more robust study to measure some of these outcomes a little bit more definitively. Kopano, I don't know if you want to add.
Yeah, thanks, Matthew, for the questions. And I must say, a lot of the work you've done, in the work you supported DSD with, has been very inspiring for us, and push this on. We're all excited that we're kind of keeping this fire going. In terms of your question around birth weight. Yeah, so we have follow-ups currently underway as we speak, both SMS and Telephonic, and some of these questions around birth weight have been added. As Christina says, this was a little bit of a natural experiment. There was this incredible opportunity through VPUU, and we quickly thought, how do we use this opportunity to add to the existing empirical data that we have locally? But we'd absolutely welcome, I know you've put here some thoughts around confounders and other things to consider, Chantal, as well. The report is available on our website after this meeting. Please do write to us. I think this is, we want to use this opportunity to strengthen the argument for maternal support. I think we all agree that there needs to be improved nutrition support for pregnant women. And so those of you here who've got experience, please do shoot us a mail. We'd be happy to have a call. We're doing this follow-up, and fingers crossed, we understand from Michael, without putting him on the spot, that potentially this support might continue even beyond these 4 months, which is super exciting. And so we really have potentially a year worth of support for these women. So subsequent opportunities to touch base with them around breastfeeding, around the introduction of complementary foods, etc. So Michael, Chantal, Julian, anyone else on this call who's got some thoughts around how we improve the questionnaires for subsequent surveys, please do reach out to us.
Thank you, Kopane. Unfortunately, our time together is drawing to a close, but before we wrap, we have the great privilege of benefiting from some closing remarks from Koketso Moeti, the CEO of Amandla.Mobi. Amandla.Mobi have too been advocating for improved maternal support for quite some time now, driving a petition on their platform for an extension of the child support grant into pregnancy, and even successfully managing to get a response from the DSD advising that the policy is under discussion and that public comments are being finalized. Koketso, as we close, tell us how we can take today's discussion into tangible actions, particularly as we grapple with the number of competing social needs, such as free higher education, the basic income grant. The common push from political heads is that there's no money. Do you buy into that? What can the Ordinary South Africa on this call today do to help turn this policy aspiration into an action?
Thank you so much, and thank you for all of the inputs that we have heard today. Excellent initiative. So before I answer your question, Dudu, I just want to tell you a little story. In the street adjacent to the street where I live, there's a Methodist church there. The Methodist church has always run a soup kitchen. Before COVID, before the pandemic ever struck, every morning it was very striking to see the long line, as the soup kitchen started. Now in more recent times, as we live through this pandemic, one of the very striking things that you see as I walk my kids to school, the line snakes on longer. It now goes around the entire block twice every single morning. During this period, a significant number of people who are now joining the queue has been pregnant women and mainly women also who have other kids already. And there was a call that was made to the community that, can we please assist with containers, Tupperware for food, because many of these women wanted to also collect more food so that their kids could eat later that day as well. That is just one small place in this little community in one street where I live. But it is so instructive about what else is going on elsewhere. It's a difficult time right now. Hunger, which existed even before the pandemic, continues to rise. Jobs have been lost, and there's death everywhere. We know that social grants were not enough to put food on the table, as well as meet other living needs, even before the pandemic. And in this moment, we find ourselves with the cost of basic necessities, from food, from the hygiene products you need to survive and so on, just continuing to rise, and a less than inflation related increase to grants. we risk facing a humanitarian crisis. And women and children, as we've heard today, as we've heard from multiple other reports, being amongst those who are worst affected by this. For 2 decades, we've had serious stunting rates, far higher than what is reasonable for middle-income countries such as ours, far higher than our developing country counterparts. We know that stunting traps families into intergenerational cycles of poverty, and with mothers who suffer from stunting being much more likely to give birth to stunted children. The inaction around this has consequences that will cast long shadows on generations to come. It is unjust that pregnant women in South Africa have to choose between other necessities and their basic well-being. And it does not have to be this way. There are only over 1 million births in SA per annum, as has been stated. So extending the child support grant into pregnancy is a small investment when one considers the returns. Of course, we often hear, where will the money come from? How will we fund this? But a better question to ask is, what is the cost of not providing funds for this? What are the implications, not just in the moment, but for generations to come beyond this moment? And of course, we sit daily and read newspapers, listen on the radio, as billions are reported as being missing, as millions are reported as having been wasted. We sit and watch activities like the normal State of the Nation addresses that are done, the pomp and the ceremony. And this year, we know just how much was saved because that was not possible. But over and above that, last week's example of funding being reprioritized from the budget for NSFAS is a good example of how public outcry can result in the finding of money that was initially not claimed to be there. This is about what are the priorities and how do we ensure that money is put to what should be the priorities. Over and above that, we have seen so many gross inefficiencies in our systems. We are talking about the number of embassies and diplomatic missions. If we think about how many South Africa has compared to other countries, even richer countries like Norway, Denmark, and consider the cost of keeping up almost 125 diplomatic missions, there is room for greater efficiencies. And this is just one example. Another example, personal income tax. In a society with as much inequality as what we have, we know that those who are wealthier are not paying their fair share, and that tax actually has the potential to become a redistributive mechanism that undoes that gap of inequality. We need to be more deliberate about taxing the wealthy at a higher rate. Currently, there are over 150,000 people who earn a salary of over 1 million per year, who will not go hungry if they pay a little bit more in tax. There are 300,000 plus people, multimillionaires, who have mansions and millions in their bank accounts. Researchers have proposed an annual net wealth tax for those whose wealth is more than 3.8 million rand. There are different tax rates being proposed by this research, and we support the highest net wealth tax of between 3% and 9%, because this is what we need to do if we are going to increase social grants and take steps to introduce a maternal support and basic income grants, which, contrary to what some will have us believe, are not competing. They are actually so complementary to each other. Our leaders have failed to tax the rich properly for decades. So these higher income tax rates on the rich are necessary if we are to reverse budget cuts to social spending and have the money necessary to realize so many other goals that we should be having. These are just a few examples of how the question of where will the money come from can be answered. But yet again, the future of children in Mzansi hangs in the balance. We have to act now. So I encourage you all to please visit the amandla.mobi website on www.amandla.mobi and support the campaign there. And also visit the Grow Great page to show support, because this maternal support grant can have a meaningful impact, a real world impact on lives, not just in this moment, but in the future to come. Thank you.
Thank you so much, Koketso. That is a lot of information and like something for us as we close this to think about and answer the question if someone asks, where would the money come from? So this Sunday marks the Human Rights Day in South Africa, a day where we affirm the democratic values of human dignity, equality, and freedom. Access to food is a basic human right enshrined in our Constitution. However, many South Africans, particularly women and children, as has been illuminated in today's report, this is not a lived reality. This needs to change. Support the call for maternal support grant by visiting amandla.mobi and signing the petition. Your voice can make the difference. Thank you all for joining us today and take care. Bye.